Hello, everyone, and welcome. Today's presentation is on holistic addiction recovery, focusing on understanding addiction through the disease and biopsychosocial models. Our objective is to provide you with a foundational understanding of addiction and introduce you to the disease model. We hope this will be a valuable resource for you. Let's start by understanding addiction itself. We'll explore it as a disease, looking at its historical context, and how our perspectives have evolved. It's crucial to recognize the role of stigma in how we perceive addiction. Remember, addiction is a chronic brain disorder characterized by compulsive substance use despite harmful consequences, affecting the brain's reward, motivation, memory, and related circuitry. So, what exactly is addiction? It often begins with recreational or social substance use. Casual use can become habitual, leading to increased frequency and dosage to achieve the same high. As tolerance develops, individuals may require the substance not just for pleasure, but to feel normal, leading to dependence. Tolerance is a key concept to understand. It refers to the body's adaptation to a substance, requiring increased amounts to achieve the desired effect. This is a physiological process, and it's a significant factor in the progression of addiction. Now let's delve into the disease model of addiction. This model views addiction as a medical illness, rooted in genetic, neurological, and environmental factors. It's chronic and progressive, affecting brain structure and function. Key elements include loss of control, craving, and continued use despite consequences. The disease model emphasizes that addiction is a chronic brain disorder, not a moral failing. Research from NIDA shows that addiction involves changes in the brain's reward, memory, and judgment centers. As neuroadaptation occurs, the brain requires the addictive substance to maintain balance, leading to compulsive behavior despite negative consequences. Let's look at the biological basis of this model. The DSM defines addiction as compulsive substance use despite harmful outcomes and loss of control. Dependence is the body's adaptation to the substance, leading to withdrawal symptoms. Genetic predisposition, brain changes like dopamine system dysregulation, and neuroadaptation all contribute to addiction. Next, we have the biopsychosocial model of addiction. This model takes a holistic approach, considering biological, psychological, and social factors. It emphasizes the complexity of addiction, including trauma, mental health, and environment. Recovery involves addressing all aspects of a person's life. Integrating these models allows for a more comprehensive understanding of addiction. Holistic recovery involves integrative healthcare, counseling, and support networks. We need tailored interventions that respect individual experiences. While understanding addiction as a condition is important, it's even more crucial to ask deeper questions. What is the cause of the addiction? Are you running or hiding from something? Are you self-medicating? What is the cause of your troubles, pain, hurt, or shame? Substance abuse often represents maladaptive behaviors, an attempt to cope or mask underlying pain. This characterizes psychological dependence. Psychological dependence is the perceived need to use a substance to cope with unpleasant feelings like depression, anxiety, or stress. When we stop using addictive substances that mask those unpleasant feelings, they return, along with strong desires to return to the substance to cope with them. This highlights the importance of addressing the underlying issues driving the addiction. As Chris Prentice said in The Alcoholism and Addiction Cure, when the underlying problems are discovered and cured, the need for alcohol or other drugs disappears. It's especially important to address feelings of guilt and shame because these feelings often underlie addiction and reinforce negative behavior, like substance use. Holistic recovery strategies involve a multifaceted approach. This includes medical support like detoxification and medication, counseling such as cognitive behavioral therapy and motivational interviewing, and community support through peer groups and holistic wellness practices. There is hope for recovery. Although addiction is recognized as a brain disease, recovery is possible through comprehensive treatment and support. This includes therapeutic interventions, family support, community involvement, and building coping mechanisms. Let's open the floor for discussion. How does the disease model help in reducing the stigma around addiction? This is a crucial aspect of understanding and addressing addiction effectively. The disease model has several strengths. It reduces stigma by framing addiction as a health issue rather than a moral failing and deficiency in character. Understanding addiction as a disease promotes compassion-based treatment approaches. It also guides medical interventions, like medications such as buprenorphine, which can promote long-term recovery through consistent management. What challenges arise when applying the disease model to holistic recovery practices? It's important to consider the potential limitations and ensure a balanced approach. The disease model also has limitations. It carries a risk of labeling, which can lead to a sense of helplessness or lack of control. It may lack focus on personal responsibility and behavioral change. There can be an overemphasis on biology, potentially neglecting psychological and social factors. Some argue it pathologizes normal coping mechanisms. Let's engage in a reflection activity, integrating holistic approaches. Consider cases where multiple factors influence addiction and how a holistic approach could address each aspect. Remember, holistic addiction recovery incorporates physical health, mental well-being, social support, and spiritual growth. Techniques like yoga, nutrition, meditation, group therapy, and peer support networks are valuable components. In conclusion, understanding addiction through multiple lenses aids in effective treatment. Addiction is a multifaceted issue that requires a holistic, integrated approach. Combining the disease model and biopsychosocial model enhances treatment effectiveness and supports long-term recovery. Holistic addiction recovery is a lifelong journey, combining physical, psychological, and social interventions.